The shortage of healthcare professionals in rural Canada has been a big problem in recent months and years, especially in the north. We've been reporting just yesterday, in fact, every province trying novel approaches to close the gap and to increase services to people outside the big cities. We were talking about Charlottetown yesterday on UPEI, a new partnership that's going to train people from the island, give them medical school training there on Prince Edward Island. Well, similarly, very interesting new partnership between Queen's University, which is in Kingston, Ontario, and a health authority on James Bay that's going to allow young people to be trained where they live. They're not going to have to travel for post-secondary education. Lynn Innes is with us. She is the president of the Weeneebayko Area Health Authority in Moose Factory, Ontario. Good morning and welcome, Lynn, to our program today.
Good morning, Heather.
Really nice to have you here to explain this. As I said, it's an exciting time for people who are going to be involved in this. Tell us, first of all, about the program itself and how it's going to work.
So Queen's and Weeneebayko Area Health Authority have a long-standing history in providing care in the James and Hudson Bay Coast. And now we've opted to take it to the next level to form a partnership which will enable us to provide education and training right in our region, so our local First Nations youth and communities don't have to travel south for education, for training and healthcare.
So they can leave high school and then go on to post-secondary education right there at home?
They will be able to once this partnership is up and rolling in 2025.
So what difference will that make? How much of a barrier will that help you overcome?
It'll be a huge difference, especially for the hospital, because we'll be able to build capacity and sustainability, as well as future growth for generations to come. And it'll also enable students to not have to leave home and have the struggles that I had as a teenager going into post-secondary education. I had to leave my family and support system.
So you have a personal connection to all of this as well, not just an official capacity. You experienced having to leave and then come back. This is something that, how do you think it would have made a difference in your own life?
I think it would have made a huge difference because having your family there to support you the whole way through is huge. And I didn't have that because my family stayed here while I continued my studies. So I think it's going to be a huge benefit to all of the children now and for future generations along the James and Hudson Bay Coast.
And just so we understand clearly, we're talking about health professionals receiving training once this gets up and running. What sort of programs will be in place? What sort of jobs will you be teaching people to perform?
Well, it's our goal to have the nursing program, midwifery, medicine, and other health professions being trained right in our region on our education campus for the next, well, hopefully starting in 2025. We did have a community college here that did provide nursing and paramedicine that have, helped us fill a lot of positions in Moose Factory, and we're hoping that will continue and grow.
And then the overall aim is, yes, they can stay there and learn, but is the hope too that they then will stay there and work?
Yes, it'll be part of our global local retention, recruitment and retention strategy, because we know that growing our own is best for us to retain as much staff and trained professionals as we can.
So that's so interesting because this is something we've been talking about extensively in these last weeks and months, the difficulty of recruitment, but also retention. So if this works when this program gets off the ground and you see it, I mean, what do you think in terms of the example it could set, the potential template it could provide?
Well, the way that we have built it in collaboration with Queen's is that it could be modeled anywhere in the country or in the globe for that matter.
What kind of a reaction are you getting from people, and specifically young people in the community so far?
They're really excited about it. We launched a pathway last summer where we enabled a few students to go down to Kingston for a couple of weeks in the summer just to get immersed into Queen's and to Kingston to see what it's like to attend a school, university, and a hospital away from home.
Thank you, Lynn. Appreciate learning about this. You said 2025 when you hope to get this up and running. We'll stay in touch and wish you much success with us. This innovative approach. Thanks for being our guest today, Lynn Innes.
Thank you.